It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our next guest, Dr. Christina Wong, board-certified osteopath physician at the sports medicine clinics in Ballard and Northwest Outpatient Medical Center. We're talking about repetitive injuries in youth sports. What do we mean by that, Shannon?
It's overuse injuries in youth sports. We're seeing more adult injuries in the youth athletic population. Too much, too soon, too fast. Kids playing one sport the whole year long. We've talked about it before, but it's a real issue.
All right, Dr. Wong and Shannon O'Kelly.
Dr. Wong, welcome to Health Talk. How's it going?
Things are going really well. Thanks for having me today.
Oh, thanks for joining us. This is probably a busy time of year for you with school getting back started and athletics starting up, kids getting back to teams and sports physicals, et cetera, et cetera. But we're going to talk about repetitive injuries and stresses in athletics, particularly youth athletics. But before we go there, I always like to find out about your practice. Give us your story.
Great. So I work at the Sports Medicine Clinic, which is a part of Northwest Hospital, soon to be University of Washington, and it's located in both Ballard and Northgate. There's two separate offices. I practice both family medicine and sports medicine, so I deal with a variety of normal ailments for your athletes and regular weekend warriors, and then also deal with normal family medicine ailments.
So you have an interest in family medicine, but a subspecialty in sports medicine and athletics and recreational sports and those kind of pursuits for the family, really.
Absolutely. I think that any athlete will have its normal ailments, including colds, coughs, whether it's blood pressure issues in a marathon runner. You just have to know the full spectrum, and so I feel like it's a good tool to be able to deal kind of the whole body with any athlete. And
you mentioned soon to be University of Washington. Let's talk about that's kind of full circle for you. You're a local kid that grew up in Federal Way and then went to medical school or went to undergrad at the UW and medical school. Tell us about that journey. And then, as you're a medical student, I'm always interested to find out from physicians, why family practice and why sports medicine. You had to have something in your past that was like, that's kind of interesting to me.
Yeah, I grew up locally in Federal Way, went to Federal Way High School, played lots of sports throughout my time there. I did tear my ACL when I was a junior.
Oh, you're a patient too then.
Yeah, when I was a junior in high school, and so I kind of experienced the rehab process and whatnot, and so I just have a passion for sports and athletics in general. When it came to medicine, it was really about treating the person and having a good connection with people, and so as I went through my training at the University of Washington and then medical school at Pacific Northwest University of Health Sciences. That's out in Yakima, Washington. I really just wanted to find a way to deal with patients of all ages, but then again, incorporate some of my passions, which is sports and athletics.
And in that program, that medical school program, you did something at Virginia Tech, kind of is that what you call that, a fellowship or specialty training in sports injuries?
After medical school, you go through residency, which is anywhere from a 3 to 5 or 6 year course of whatever your specialty is. I chose family medicine, as I mentioned, and then I chose to do an additional fellowship in sports medicine. So that's when I left to be in Blacksburg, Virginia at Virginia Tech, where I helped out with their football team, basketball, soccer, wrestling, anything you can think of. And then we did a little bit of side work with the New Orleans Saints while I was there as well.
That sounds exciting.
Yeah.
Sounds fun. Do you have an area in sports that you have a passion and you like to work with that type of athletics or that sports team?
I love baseball. It's just,
really?
I played softball, actually. That was my main sport growing up. And so going to Mariners games when I was younger with my dad and my sister, it was just kind of something we did all the time. And as I grew in my medical career, I continued to help out with the Tacoma Rainiers and a little bit with the Seattle Mariners. And so it's just been a fun experience. And I love the sport of baseball, so I love working with those athletes the most.
Good. That's a fun sport. And talk about a sport that has repetitive trauma and overuse potentials. As a physical therapist, and I'm sure as a family physician with a sports interest, I think we've both probably seen over the years there's a little controversy out there right now in sports with kids maybe doing too much too often, and maybe the one-dimensional athlete that just does, for example, one sport all year. They're on a high school team, they're on a select team, they travel, they're going to showcases. Sometimes just not a lot of opportunity for the body to heal or rest, and we see these repetitive or overuse. Let's talk about that a little bit.
Yeah, well, there are 60 million youth athletes out there that are participating in some kind of organized sports, and about 45 to I think 54% of them will experience some kind of overuse injury throughout their career. earlier. So it is really important to kind of allow them to go into different sports and really experience different movements with their body so that they don't have those overuse injuries.
Back with Dr. Christina Wong and Shannon O'Kelly after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Continuing our discussion on repetitive injuries in youth sports with Dr. Christina Wong and Shannon O'Kelly.
Dr. Wong, again, thank you for joining us on Health Talk, and thank you for spending time talking about overuse and repetitive injuries in athletics, particularly youth sports. I guess we want to focus on that because you just mentioned 60 million kids play sports. 45% of them will experience some type of injury. That's 30 million kids per year that potentially get injured. Those injuries have to heal. It takes time. We talked about different sports using different muscle groups. What are you seeing right now in your practice?
Yeah, I mean, I have a particular interest in youth athletes, mainly because they're so fun to treat because they're so motivated to get back, and there's so much to teach them about how to prevent injuries and how to be a really good athlete and a well-rounded athlete. So the biggest things that I'm seeing, in baseball players and just softball players, anybody who does an overhead activity, is a lot of repetitive shoulder or elbow injuries. In your runners, you can see stress fractures of the tibia or the femur, which are the long bones in the lower legs. You can certainly see a lot of overuse injuries in gymnasts as well. So there's no bias towards any sport to get an overuse injury. And so really it's kind of about teaching these athletes to, one, maybe consider not specializing too early and really just allowing their bodies some time for rest throughout the year.
And some time for rest. I mean, if an athlete is not healing and has chronic pain or problems with activity, probably a sign that needs to be looked at, because generally speaking, youth athletics or athletes will heal fairly quick. They've got youth form, right, with them. And if that pain lingers and is a problem, it needs to be checked out. There could be a fracture. There could be a stress fracture, like you said, some kind of tear. But let's talk about cardinal signs maybe, or things you shouldn't avoid as a parent, coach, or an athlete. Yeah,
so every kiddo will have some kind of pain that they report. And so the biggest thing is, if you notice, especially in a youth pitcher, that their velocity is slowing or that they have pain every single time that they pitch or every throw, you really want to listen to those signs and symptoms. A little bit of soreness after participating in a fall sport after not doing anything all summer long, that's a little bit different than saying, hey, we're kind of getting into mid-season here. We've been practicing for a long time and I'm really just not seeing any improvements in your physical abilities, or we're really just noticing that you have pain all the time. So classically, just complaints of pain, potentially some swelling, or just, again, some decreased velocity in whatever sport they're participating in.
Yeah, particularly, with kids and young athletes or youth athletes, a lot of times back pain is not uncommon to get some muscle aches and pains, but if that back pain continues and you have pain at night and it doesn't change with moving, back pain in kids probably needs to be looked at, particularly when it comes to people or athletes like gymnasts or linemen are doing like hyperextension type stuff.
Exactly. Mm-hmm. Yeah, and really your clinical suspicion should be low if they have the right sport that they're participating in, where they have lots of hyperextension or just lots of repetitive injury, to consider getting more imaging, such as x-rays, potentially MRIs in the future. Not all of the overuse injuries really need imaging. It really just depends on where the body part is that they're hurting. So you have to take a look at all of the picture together.
I think the message here is, as we wrap up, and again, great stuff, is don't sit there and think it will go away if it doesn't go away. Get in and get it looked at, because you can treat it a lot easier and more effectively if you get to that injury early.
Absolutely.
Dr. Wong, thank you for your time.
Thank you.
That was Dr. Christina Wong, and you can get more information at uwmedicine.org. That's where to go. We thank her for joining us. And Shannon, that's something you have to watch out for, especially, as you mentioned, with kids specializing now.
Awareness. That's what it's all about, understanding what's going on.
Our next guest right after this time out on Como.